and welcome to Workforce Wisdom. I'm your host, Christy Bray, Chief Customer Officer at PracticeLink. This podcast focuses on the latest trends in healthcare recruitment, showcasing innovative strategies, success stories, and fresh perspectives that impact the healthcare workforce. These episodes will lead to in-depth, thoughtful discussions with recognized industry-leading healthcare professionals exploring the challenges of healthcare recruitment and beyond. Whether you're an experienced recruitment professional or just starting out, this podcast aims to help you discover how experts are reshaping the industry, leveraging technology, and fostering inclusive hiring practices. Today's episode of Workforce Wisdom, Leadership Without Drama, Coaching High-Trust Teams with Culture First and Compensation Second. I'm happy to welcome our guest, Dennis McIntee.
Hey, Chrissy, really great to be here. And it's really funny, like you said, right? You said culture first, compensation second, right? And that's got to be for some people like just a, wait a minute, that's not true. Because here's typically what happens, right? We typically hire people for what they know, but we have to release them for who they are, right? Isn't that true? And many times, it's these, maybe some of these behavioral things that, hey, they're really like smart and they know this and that, and they have all these skills, but it's also like mindset. It's also things like character. And many times, like, I think the challenge is people bring their own culture into our organizations, right? And sometimes they think their dysfunction is functional. So this is a great example. So I've been married for, 34 years. And our first year of marriage, I remember I brought my wife, to our family reunion. And about 2 hours into it, she took me to a back room and she said, "Dennis, are you guys crazy?" I was like, "What are you talking about? What's the problem?" She goes, "What?" And I see, because I come from the family that has 3 rules, right? Our first rule is he who yells the loudest wins. He who sustains the yelling the longest wins. And number 3, the goal is to always win. And so I thought that was normal, right? And then I went to my wife's family reunion and I was like, I don't think we're so functional, right? Because it was normal to me. So I love like how you just put it, like culture first, compensation second. If we can, make it about culture, that's sort of like where lasting, sustainable change happens.
Absolutely. Yeah, absolutely. Let me go through your bio for those listening so we can...
It's not that exciting. Come on.
I think it's pretty exciting.
Okay.
All right, Dennis McIntee is a business consultant, gifted keynote speaker, executive coach, and author, travels the world speaking at leadership summits, management training events, and healthcare conferences, just to name a few. His 3-decade career included stints in Africa, Poland, Germany, and throughout Europe, where he coached and consulted with emerging leaders. Through his experience, Dennis has developed a systematic approach to helping his clients reach their goals through coaching, speaking, courses, and techniques that enact transformational change. Ultimately, Dennis is passionate about helping leaders create high-trust, high-performance cultures while becoming the best version of themselves they can be. Dennis is also the author of The 8 Qualities of Drama-Free Teams, The Power of Pursuit, and Drama-Free Teams in Healthcare. He has been married, as he said, to his wife Lisa for over 30 years, and together they have 4 children. Dennis is an avid runner and enjoys training for races. So welcome again. I'm excited to jump right in on these leadership and culture topics.
Yeah, Chrissy, I've always enjoyed our conversations. We don't know each other super well, but it's always fascinating just to kind of get your perspective. Now, I do want to make one quick correction on the bio. Okay, is that I am a poppy to 2 amazing grandkids. So I just realized we got to fix this bio because I love my kids, but man, I really love my grandkids even more. So it's fascinating how that has kind of transpired in my life.
Yes, I think my parents would say the exact same thing. So that's a normal statement.
I think so.
Well, congratulations. It's always interesting too to hear what people choose to be called by their grandchildren. Mine are Nana and Papa, but I've already decided what mine will be, although I have many years to wait for my children to be parents. So,
well, it was new to us because I come from the Midwest and it was always grandpa, grandma. When our son, they got pregnant, one of the first questions is, you got to choose a name. I was like, what are you talking about? Choose a name. Right. But it's almost like, names are super important because, names determine like how you view things. Right. You can think about culture, like we name certain things and it determines how I view it. Right. Things like that was so disrespectful. Well, you've named it disrespect, and how you name something determines how you feel about something.
Yeah.
She made that disrespectful comment. Well, she made a comment, disrespectful, up for interpretation. But if I name it that, right, it's sort of like I can have these highly charged conversations because I name something, it's how I experience it.
Yeah.
So it's a fascinating sort of like psychological sort of study that how you name something determines how you experience something.
Yeah. And I think that we often put adjectives that end up being those labels. Probably a better word ends up being stereotype that carries forward. And, you're absolutely right. Like the perception of that personal individual was that about the comment or whatever. Other people may have been okay with it.
Yeah, it's because it's how you see something determines what you believe about it, and then ultimately how you act out of it.
Yeah. Yeah.
And so I think some of these impressions or things that people have, I think sometimes we just have to check it a little bit, especially as leaders and leading teams and recruiting and meeting people and onboarding and all these fun things that everybody gets to do.
Yeah. Yeah. Well, let's jump into a little bit about that trust factor. So you emphasize the importance of trust in leadership in the work that you do. How does that translate into healthier workplace cultures? And particularly in high stakes environments like healthcare.
Yeah, absolutely. Well, when you think about it, and Stephen Covey's the guy who really sort of got this started about 20 years ago at the speed of trust, is that as trust increases, speed goes up, cost goes down. Right. Because as I increase trust, I don't have to worry about Christy, what did you mean by that? Mm-hmm. Right. And then I have things like the meeting after the meeting. You know what I'm talking about? Right. It's like we have the meeting and I don't have enough trust to talk about what I really need to talk about, but I have a sidebar meeting. Right. And then we just burn 30 minutes, you and I talking about something where we really should have just brought it up to our senior leader.
Sure.
Right. But there wasn't that trust. And so it plays itself out in so many ways. So you think about how much cost, how much time are we burning, right? Because we don't have these trust levels and the speed of business sort of goes down. It literally, Chrissy, even like our relationship with PracticeLink, it's like we can do projects together and we don't have to necessarily exchange contracts. And it's like, hey, I want to do this. You want to do this. Let's just start doing it because you trust us. I trust you guys. Right? We have this high level of trust. So you think about even our conversations, we do stuff very quickly together. Like I'm all for contracts, I'm all for clarity, I'm all for MOUs and all of that. But, when we can increase the trust, we don't have to do some of these dances that maybe happen in other organizations.
Yeah.
And I'm not against that. Okay. So sometimes people take that and they just run with it. But it's an interesting mind exercise to think about.
Yeah. Do you equate trust to empowerment or autonomy or some of those other factors?
Well, I think it all plays into that, right? Because because that whole thing about autonomy really means if you're autonomous, it means self-rule. It means that you are able to rule yourself. Part of our book, Drama-Free Teams in Healthcare, really goes after this idea of many times in healthcare, people act like children, so we treat them like children. Right. And because we treat them like children, they act like children. Like I'm going to tell you what to do. In a little bit, it's this idea that we have to believe in people's personal power. It's like, I believe you're powerful enough to solve your own problems. And so we're really sort of after this. I don't want any adult to child conversations. I want to have an adult to adult conversations. But to do that, I have to believe that you can be autonomous, and autonomous is taught, right? Autonomous really becomes a mindset. And here's what's fascinating is we use words and we think we've communicated. And really communication is just a transference of meaning. For example, so one particular healthcare system, they had this, one of the core values is, we're kind to patients. Okay, right? Very simple. We're kind to patients, right? Got it. So this one nurse, the charge nurse brought her into her office one because she was kind of snarky with a family member and snarky with a patient. I'm sure nobody in hospital work has ever seen that. And she brought her in. Literally, this is what happened. She said, "Hey, listen, here, one of our core values is that we're kind to each other." And she said, I didn't cuss them." In her mindset, right, that's what that meant, right? And so many times it's like transference of meaning. Not necessarily words. And one of the best ways to do that really is through storytelling, right? Hey, this is what kindness looks like to me. This is what kindness means to me. And sort of give that context. And I think, gosh, for building trust, I totally believe that is one of the key skills for leaders to really get a handle on is always creating that context and sharing your why, sharing the meaning. And it's like, you cannot overshare that enough.
Yeah. Yeah. You've already brought examples forward on some of the best authors and leadership coaches that I've found from Defining the Why from Simon Sinek and then Stephen Covey.
Yeah.
I wonder in some of that, where does internal trust of that leader come from or have to grow to be able to, delegate in a way that, whoever they're delegating to, they feel the support and they have the technical tools they need, or, those types of things where it takes a while. Some people may not intrinsically have that skill set, even as a leader.
Well, I think many times, like, we call these things trust issues, but they're really communication issues. And here's what I mean by that is that, so say, Christy, I give you something to do. Like we agree that you're going to go do this, right? And so tonight when I'm taking a shower, I'm like, did Christy do that? I don't know if Christy did that, right? It's like I got this, we call them open loops. I got this open loop inside of my head, right? And then the next day you walk by my office and I go, she didn't say anything. I don't know. Right? The whole day she goes by, I've seen her 5 or 6 times. And by the third day, I'm like, hey, Christy, where we're at on that? And you go, Dennis, I did it as soon as you asked me.
Right.
Right? What, don't you trust me? And here's what we kind of teach leaders is that you have open loops. And so it's this idea we say closing the open loop.
Okay.
It's like, hey, this is our agreement and you close the open loop. And at the foundation of trust is accountability. But accountability is not something I demand from you as a subordinate. It's a gift that you give me, which means I have the ability to give an account. And we tell people this all the time. It's like, hey, this is not a trust issue. This is just a communication issue. Will you help me close this loop?
Mm-hmm.
And so many times, like agreeing upon a deadline.
Yeah.
Hey, right. And then we also teach people that, you always want to communicate on the front end, not the back end. Right. Because if I tell you, Christy, I'm going to have that by noon on Monday, it'll be like 9 o'clock Monday morning. I sort of know in my mind, you're not getting that. Right. It's just craziness happened, stuff happened, but I don't want to wait till after 12, right? I want to, like at 11, call you and say, hey, I know I said by noon, this and this happened. Can we renegotiate for this? And then we're having these adult to adult conversations.
Right.
Right. But it's really teaching where accountability lies, because I think at the foundation of real trust becomes this accountability. But it's my ability to give an account, not something I demand from you. And one simple way that we teach it is just closing open loops. And it's a fun way to kind of have a conversation.
Yeah.
Hey, can you help me? It's like almost as a leader, hey, I need some help. I get these crazy loops inside of my brain. Could you just help me and tell me where we're at?
Yeah.
Right. And then it's not a trust issue. It's just a communication issue.
Yeah. I think for me, one thing that what I need from those that I'm leading, or even those, you're working side by side with, is acknowledgement.
Yeah, exactly.
Read it, got it, doing it, whatever the response might be on that. We, Outlook or our email systems make it easy. You can accept an appointment. Somebody wants time off and you see it and they say yes. And there it goes. They get a red receipt or all of those things.
Yeah.
The acknowledgement of that helps me to understand your level of accountability. And for me, builds that trust. So I don't know if that's something you talk about, just that acknowledgement of got it, read it, did it.
Yeah, because watch this. If I don't acknowledge it, then I can just play the victim.
Sure.
Come on, right? It's like, oh, I didn't see it. Oh, I didn't know. But as soon as I say I got it, all of a sudden, like, I have to act like an adult. Wow, now I have to act like an adult. And so really what we go after when we think about drama-free is we go after this victim blaming, right, where I'm not taking responsibility for my actions. Right. And we see it like in excuses or rationalization, justifying, right? All these kind of things. And they're really just symptoms of me playing victim.
Mm-hmm.
And the crazy thing, Chrissy, is that we all do it. If we're not careful, here's how leaders do it. They go, well, my team blank, blank, blank. Well, if these guys would just blank, blank, blank. And if I blame my team, then I'm really just playing the victim.
Yeah.
Oh, poor Dennis. Yeah, Dennis doesn't have. Dennis didn't hire these people. HR says I can't fire them. Yep, I'm just a poor victim. And even leaders, if we're not careful, we kind of fall into this, right? Haven't you found yourself falling into that at times?
Yeah. I mean, you see that, like the example you gave, I didn't hire these people.
Yeah.
Yeah. They say it all the time with like college football coaches, well, he didn't recruit them. Give him a year or two, kind of a thing.
Yeah. Yeah. Well, here's a little system that we talk about for meetings. It's called the R&R system. And so when we think about meetings, and meetings are they could be a staff meeting, they could be a one-on-one interaction with it's RR. It's here's the reason, here's why we're meeting, and here's the result. Mm-hmm. Right? Everything has to have an R&R. It's like, hey, I want to know why we're meeting. And then there's always needs to be, and even if the result is, Christy, let me think about it, we'll get back tomorrow. That's a result. Even if I don't have to have it or don't know an answer or not sure, but always having that R&R. And honestly, like Chrissy, when you teach this, like across the organization, across the system, it really holds people accountable. It holds leaders accountable, because then I never go into a meeting, even if I'm not leading the meeting. I want to know the reason, and I want to know at the end, what's the result. Right. And even if I'm not leading it, I can always ask the question. So what's the end goal? What's the end? What's the next step? And really it sort of like holds everybody accountable.
Yeah.
And I even have team members do that to me. It's like, it's fascinating, because sometimes I just get into the drama of it. Right. And they're like, so Dennis, what are we really talking about? And I really don't know. I'm sorry.
Yeah, I spent a lot of time working for an organization that worked within the Malcolm Baldrige framework.
Oh, yeah. Beautiful.
And so when you get strong organizations like that, from agenda planning, and you've got mission, vision, values always right in front of you, or the reason for the meeting, this committee was established to blah, blah, blah. And then you get the minutes. And I was an executive assistant for that organization for many years. And so you really got to see what you just spoke about. Like, your agenda should be part of that reason and drive here's why we're here. Your minutes in a normal business setting, right? The agenda and the minutes are the two pieces I think you just talked about that are tangible to folks.
Yeah, well, and it's almost that idea that clarity is power, right? And many times, like, we get into like what I call the fog of drama, where it's unclear expectations and reality, right? And so, but a lot of times, here's the thing: if you're a person that has a lot of drama, like you like to play the victim, getting clarity sometimes is not so fun, right? It's like, yeah, now I really am accountable, and I'm not sure I want to play that game. And I think as leaders, they have to decide, hey, here's the game we're playing. And so really we teach people how to play the no drama game. And it is simply 5 or 6 frameworks that you continue to roll through your organization. Simple, not easy. Let me say it that way.
Absolutely. And definitely not overnight. Like, none of these things are just flip a light switch and it's fixed the next day.
No, because I think you teach what you know, but you produce who you are. Right. And I remember one of our first classes that my wife and I, when we had our first son, and we went to a parenting class. And here's what was fascinating. We thought it was going to be all about our kids. Guess what it was all about, Chrissy?
You.
All about us, right? It was like, we thought we were going to, right? It was like changing how we parented, changed how our kids showed up. And I think it's the same with leaders. A lot of times, and here's the thing, people bring us in and they say, Dennis, I want you to fix my team, to fix my organization. Well, first person I'm fixing is the leader. Right? Because we teach what we know, but we produce who we are. And honestly, like, if there is drama in your organization, if you're a leader and you're thinking about your organization, if there's drama in your organization, you got to look at you first, because what have I done to sort of create that or produce that?
Right.
Tell the truth, right? Just be honest with yourself.
Yeah. So what are some of the common trust killers that you've seen in organizations, and, really for our healthcare leaders that are listening, how did there may not be a way to avoid, but how do they recover from that? Let's say some of those key things you talked about have been degraded over time.
Yeah.
How do you do that with just hiring all new staff, or, how do you rebuild that trust?
Let me say it this way, right? A great addiction specialist, and really the guy who started Alcoholics Anonymous, he always had this statement. He said, all progress starts when you just tell the truth. So I think the first thing that leaders have to do is they just have to tell the truth. We were working with a system a couple of weeks ago and just talking to the senior leader, and he had the same question. I said, well, the first thing we're going to do is you're going to get your team together and you're just going to tell the truth. Hey, here's how I've been leading, and here's the outcomes that we've had. And I just want to apologize, because I've led this way and it's produced this outcome, and I'm going to lead a different way. And so just kind of own it, because at the end of the day, especially when you try to do these change initiatives, right? People already know. I mean, people are not stupid. Like they know the past. And so I think just acknowledge the past and just kind of own it, right? Be a little bit transparent is a key one for leaders. And then also another idea that sort of is this big trust killer. So that's one idea, sort of kind of regain trust. But I think one of the big trust killers becomes excuses. Right? Every time that I hear an excuse, I know victimhood is at play, right? I know blaming is at play. I know I'm not taking responsibility. And Christy, let's think about this for a minute. What do people do when they typically make an excuse? The very next thing they do nothing, right? They just look at you like you have 3 heads. I didn't have enough time, right? And here's the principle. Your brain only goes to work on what it believes is possible. So when you make an excuse, what you tell your brain is don't go to work on it. Don't bother it. Don't even worry about it. It's not possible. right? And so we have this formula, and let's just give it to the audience, okay? Because I think this will be really helpful, because I know in healthcare systems, excuses are just gigantic, right? They're everywhere. And so we created what we call the excuse buster formula. And here's how it goes. This is a great example. A couple years ago, I had this fence that we installed, a wooden fence, put in our house. And, after about 6 months, it dries out and you got to paint it. Mm-hmm. Right? And so I have this great excuse that shuts my wife down, that shuts my team down, that I use all the time to get out. It's like get out of jail free card. And so for about a week, my wife's like, Dennis, that fence has got to get stained. We got to see. And I go, I know, I'm traveling. I'm on the plane. I'm doing this. I'm here. I'm not even home. She goes, it's got to be fixed. And I go, I can't. We went through this cycle for about 2 weeks. Okay. And I'll never forget, I was on a flight to Vegas and I'm sitting on the flight and I thought, Dennis, you are such a drama king. This is total drama. You're just making excuses. You're blaming. And then I pulled out our formula. And here's the formula. It's even though favorite excuse, how can you still get whatever needs to be done? So I said, okay, even though I'm traveling this entire week, how can I get my fence stained? Christy, and then it hit me. Do you know you can pay people to do that?
Yeah, that's exactly what I was thinking.
Yeah, right. Yeah, exactly. Right. But it's like you can't read the label when you're inside the bottle. But I'm in the bottle, and that question just causes you to step outside the bottle and read the label. Right. So you could we just used it with our team a couple of days ago. It's like, hey, even though you ran out of time on Friday, how could you still get these emails out? Mm-hmm. Hey, even though so-and-so was off on Monday and wasn't available, what could you still have done to make this project move faster?
Yeah.
Right? What it does is it forces your brain to think about a new idea. And the idea is that your brain only goes to work on what it believes is possible. And when I make an excuse, I just tell my brain, don't work on it. Mm-hmm. I mean, that's a funny example, but a true example. It really happened this way. And I was like, oh my gosh, I'm such an idiot. Of course. But I was inside my own bottle.
Right.
Those are two different quick ideas, right? So that's what I would say.
Yeah, that's good though. I always write stuff down when talking to someone, so then I can either come back to it or use it myself. So that's a great one for folks.
Yeah, well, think about this, like use it for your team. We had a healthcare system that just full of excuses. And the senior leadership adopted this. And do you know how long it took for excuses to stop? It took about 2 weeks. Yeah. Because literally you think about, Christy, if I have that conversation with you 2 or 3 times in a week, guess what you do? You go, Mm-hmm. Probably should bring down any excuses.
Yes.
And here's sort of the writer downer for people, if you're listening to this, is that whatever you don't address, you endorse.
100%.
Right? And you cannot complain about what you permit. And how many times does something crazy happen in the hospital, but we don't address it, but yet we go home and complain to our spouse about it. Mm-hmm. Right? And at the end of the day, it's like, as leaders, we permit everything. Even in, say, I know a lot of people are probably in this middle management piece, right? I'm maybe leading a team, but I got a boss and a manager above me, and I'm sort of in the middle. Every team has its own culture. You might have a large hospital system culture, but even little teams have their own culture. And as leaders, we're responsible for that.
Yeah, and I think that you also, as somebody that, has been in those different levels, as you said, of leadership, you also have to give yourself some grace that you may not have all of the answers, and you may have inherited some of the issue. And again, this leadership doesn't happen overnight, and these issues don't fix themselves overnight. But trying to, remember those things. And it's kind of like with children, what you let those behaviors continue. If there isn't some change in there, fundamentally, you reap what you sow.
And I love what you say, because, and that's a great point really to bring across that I think is really helpful for people, because sometimes we listen to these things and we're like, yeah, but I don't do this, but right? And we kind of beat ourselves up about it. And so one leader that I follow, he says that he always led with grace and truth. He says he came to him with grace and truth. And it's almost like you have to give grace before you give truth. Yeah. Because truth is super hard to swallow without grace. Mm-hmm. And many times as leaders, we just have to give grace to ourselves and not beat ourselves up. Right. And then also allow people some grace. Because it's fascinating, because a lot of times as leaders, we end up having to it becomes very transactional. Do this, do this, do this, do this. But if you think about the best leader you've ever had, it could be a coach, another boss, a mentor. And the question is were they more concerned about what you did or who you became? Yeah. Who you became all day long, right? The people in my life is who I became. And so I think as leaders, if we just help our teams just become somebody better, it's that transformational aspect, and which means I don't have to have all the answers all the time. right? And sometimes it's great to say, like, I don't know right now.
Mm-hmm.
But sometimes there is this press, like, I got to have an answer. Or no, it's like, I want to follow a human being. I don't want to follow a human doing.
Yeah. Yeah.
Right. And when I know you're human, and I know you make mistakes, and there's an art to this whole transparency thing, but if I know you make mistakes, I'm a lot more apt to tell you about my mistakes.
Mm-hmm. Yeah. And I think definitely within healthcare, it's been great. There are definitely some books, published 20 and 30 years ago that really helped healthcare to get to a space where you had that account of, think about, medical errors that happen.
Oh yeah.
That I worked in the hospital when those mind shifts were changing for us to be that, and it is very risky. That's why we have malpractice coverage and, huge plans there, but you have to be open and own those things, to get better. Like, you just have to always think about future patients or your put yourself in the shoes of some of those folks that you're caring for. I think it changes your perspective a little bit.
Yeah, well, and I think part of the problem is that people don't know what to do with the 3 time periods, right? You have a past, you have a present, you have a future, right? And we have a tool called the Past, Present, Future Evaluator that we walk leaders through, and I'll just give it to you people really quick, is that if you know what to do with the past, it becomes useful. A lot of people use the past to beat themselves up, regret, shame, right? But I think the past is simply R&D. It's R&D,
Mm-hmm.
right? It's like it's where all my learning has come from the past. Right. And if I look at it as R&D, and it's almost like last year was just Dennis 1.0, right? Today, the present, Dennis 2.0, right? And so, but if you don't know what to do with the past, right? If you don't know how to learn from it,
Mm-hmm.
so it's just research and development. And then the future is simply like for motivation, right? But people that don't know how to use it for that, they end up like they're worried, they're scared, what's going to happen. Here's the problem with that. When you don't take care of those 2 time frames, it's really hard to live in the present.
Yeah.
And that's the place value is created, is right now, today. But if I'm always thinking about the past or worried about right, because we've all been in places that we weren't really there. I'm here doing the podcast, but I'm thinking about everything that I got to do tomorrow, and I'm making my list as I'm on right. I'm not really here at the podcast.
Mm-hmm.
And so I think the key skill for leaders is really, especially in this dynamic changing world, is being where you are.
Mm-hmm. Yeah.
Did you know PracticeLink, the nation's most trusted physician recruitment resource, now offers PracticeLink Pro Marketing? PracticeLink Pro Marketing is a brand new, powerful recruitment sourcing solution built just for healthcare organizations. With custom strategies, targeted reach, and data-driven results, PracticeLink Pro Marketing helps you attract top-tier candidates and fill hard-to-reach roles faster. Ready to elevate your recruitment game? Visit PracticeLink.com and schedule your free consultation today.
I know a lot of organizations have started using personality assessments.
Oh, the old personality assessment. Yep, there we go.
And I've used them a lot throughout my career. I mean, I can't think of an employer, except for way back in my early career, that didn't have some type of thing. But and a lot of it, if it's used correctly, you're using it to put together the team.
Yeah.
You're pulling from these different aspects of folks. But what role, really does like personal responsibility or that culture that's embedded in you play in leadership effectiveness? And, and how can organizations really help to foster that? Maybe you have a lot of this type and you need more of this in order to get the right recipe for success.
Yeah, that is, Christy, thank you for bringing that up, because that is such a great question. And we see this question so many times, right? So first of all, I love assessments. Okay. I think it just gives language, whatever you use, MBTI, DISC, Kersey, Colby, but right, name them, right? Working Genius, right? There's always a new one, Strength Finder, whatever, right? We use a lot of them. And even like in our practice, we've used them, but I think the challenge becomes because it just gives language to talk about differences,
Mm-hmm.
right? It gives language to talk about difference. So we use this acronym called TASKS. So when I think about people and their abilities, I think about tasks. First, I think about talent, T, right? What's my talent? And there's a couple assessments that measure talent, right? And then A is my attitude, is my mindset. But there's no personality test that measures attitude or mindset. Then there's S, there's skill, right? I develop new skills, I learn new things. Nobody measures it. And then I have K, knowledge, right? I have certain things that I learn. And then I have S, I have style. So you think about talent and style
Mm-hmm.
are two great things that personality tests will measure, but inside of that, which means I can have the same exact numbers or scores as you on these different, assessments, but there's this whole middle ground that makes us all unique.
Mm-hmm.
Right. And so I kind of like to look at that. And the two mistakes I just want to kind of bring up that people tend to like make when we're using some of these assessments is, first of all, we use it as an excuse for poor behavior.
Mm.
Right. Somebody comes in and says, well, I just told them how it was. You got to understand, Christy, I'm just direct. I'm just a direct, straightforward person. That's just how I am. And I had a leader tell me that one time, and I was like in a team meeting, and I brought him to the side. I said, listen, that wasn't direct. That was just mean.
Mm-hmm.
That was arrogant, condescending. That is not being direct. He's like, right, because we kind of use it. So if we use it for excuse for poor behavior, or if we put people in a box.
With a label.
Right. And we say, you're this and you're this and you'll never be this. And I always like to look at it as this idea of like energy management. Because at the end of the day, it's like, Christy, I am not a super high follow through person. My follow through is not long. I'm not the best with details. I kind of space out after about 15 minutes. Right. But I got 15 minutes I can give it. Right. So I can't use it as an excuse and say, well, I'm just not detailed. No, it's about energy management. Now, when I work on a report and after about 15 minutes, I am ready for a vacation. Right. It's like all my energy is gone.
Yeah.
Right. And so it's more of an idea of energy management. And I think it's like this idea of how do we have conversations about it? And then how do we use them to develop ourselves and not use it as an excuse or put people in a box.
Yeah.
So I think those are sort of like two sort of things to look out for when we're using those things.
Yeah, I think those are good. Within your teams, then do you tend to like focus the agenda or do you front load some of your meetings to get like, we've got Dennis's attention now, and then he's going to be, singing a song or how do you do that where you've recognized that, which is the first thing in yourself, communicating that to your team, like I am totally still paying attention at minute 20.
Yeah.
But
and we look at things. Okay, so for example, just for me, what we have discovered is it's not good for Dennis to Zoom alone. Okay, because Dennis will get on a Zoom with somebody else, and he will co-create a whole entire program. But I always have to have a team member sitting with me or sitting on the Zoom, taking notes, like direct, keeping it focused, right? And so I've discovered I don't work well alone. It's just something about me. And so really, because I think self-discovery is more important than task discovery. So really understanding like who you are and how you work, and then just having honest conversations about it. Just because it's like honesty creates freedom. For example, we were in an annual planning meeting a couple of years ago, and a couple of team members got off and they're like, okay, well, Dennis can do this and Dennis will do this. And when Dennis is at an event, and Christy, as they're talking in my brain, I'm procrastinating. I'm already thinking of reasons why I'm going to procrastinate. Right. And I said, hold on. Let me just tell the truth. I know Dennis really well. In fact, I'm the best person in this room that knows Dennis. And I'm telling you, I think it's a good idea, but just Dennis ain't going to do that.
Right.
I wish he would. It'd be awesome, but he's not. But here's what was really cool is they just created another scenario. Well, how do we do it then? Because it still has got to get done.
Right.
And so we created this other system. And so I think really just honesty creates freedom and telling people the truth. Because one of the worst things, Christy, that happens is that you and I are in a meeting and I say, okay, Christy, yeah, I'll go do that. And I have no intention of doing that. Right. And it is literally just something for me to say to get me out of your office.
Right.
So that you can stop beating me up.
Yeah.
Right. And instead of like, hey, let's just tell the truth here.
Right.
And so we really teach leaders to like really look for like those verbal cues. For example, like you and I are having a conversation and go, well, all right, Christy, if that's all right, I'll do it. Right. How convinced are you I'm going to do it? But then the problem is that you heard me say this. And so you go back to Ken and say, yep, Dennis said he's going to do it. Yep, that's what he said. Right. And it's like, because there's this covert communication and overt. And I think leaders have to look at when there's a discrepancy, covert always wins.
Yeah.
I did this one time in my marriage. First year of marriage, don't judge me, but true story. I came into the kitchen one day and I said, Lisa, what's wrong? And she goes, nothing's wrong. And I said, cool. I'm going to go play golf for the afternoon. I'll be back in the evening.
Oh.
And I went and play golf. I discovered when my wife says nothing's wrong, everything is wrong. And I think leaders learning to like look out for that, like maybe the rolling of the eyes, right? And we don't have conversations about it, right? It's like we train people by not addressing these things.
Mm-hmm.
So really getting really, clear on like what some of this covert type conversation. And that's the work of real leadership, right? Is these nuances and these emotions of people. It's not the tactical. The tactical is so easy.
And I think that some of the technical pieces, potentially there's technology that can help. I mean, I know there's a ton of, there's note takers and those types of things. If you're in a sales role, there's things that, help you and guide you and coach you on some of those.
Yeah.
And definitely something that is taking the action items. Christy said she would do this. Dennis said he would do that. So that's a great technology leverage. How do you bring that into your coaching? So first, kind of the technology piece, and then second, as you're working in potentially a hybrid or a remote environment as a leader.
It's so different, isn't it? Like who would have thought 10 years ago we'd be here where we are right now, which is it's a blessing and that it's got its own unique challenges, right? And so, listen, we are always in the hunt for new technology, just like you guys. Like you guys are a great technology organization, us too, right? We are always on the hunt, and we run a hybrid team, so I understand what that is like. It's almost this idea. I think the problem sometimes with technology and hybrid, we're always looking for different how-tos and how-tos. And Christy, if I can just say this, like if how-tos were enough, we would all be skinny, we would all be rich, and we would all be happy. Right. And I think the problem a lot of times is like technology changes, right? Whether you use a Basecamp, a Slack, the Google suites of, right, the Teams, right? Just thousands of different, different things, which is fantastic. But an app doesn't solve it, right? A piece of technology doesn't solve it, right? It's like, how many diet books in the world do I need? It's like, what's the problem? I know what to do. It's like, I just don't want to do it. Right. It's an emotional. And so I think the key with especially hybrid teams is getting to the emotion of where things are at. And truth be told, you can only do so much of that on a video call. There are nuances that I can't read. So making those interactions in person super valuable and super really putting a value to them. Because we run a hybrid team, our time together is extremely vital and extremely well thought out and extremely very thoughtful and very planned out. We even have this whole system where we teach people how to hire. And a lot of times we have the top 25 interview questions. And what's interesting about those top 25 interview questions, none of them deal with the technical thing. They deal with all of these emotional issues. Right. Because if I can find that out, I want to hire you for who you are. And so I want to find those things out. And then just allowing people the freedom to be creative, So I would just kind of say that there's always a new technology. Haven't you found that to be true? Yeah. Right. It's like we're always looking. So I think running hybrid teams, really making your in-person time super valuable. And we even do a lot of workshops for hybrid teams where we do them on Zoom or on a Teams, and then we do them in person, always creating different frameworks so that people can get their own thinking out. And maybe that's one thing that we do that's unique to everybody else is that a lot of leadership training companies, they tell you how to think, but we sort of follow this idea as a man thinks, so is he. So there's a process of thinking. And so we give the process and allow you to come up with your own thoughts.
Well, I think that figuring out what tools, particularly in technology space, can leverage or release some of the work that you're doing. We're always looking at that from a report standpoint. I don't know anybody in healthcare that doesn't get bogged down in monthly operating reports or quarterly business reviews or whatever. It's a ton of data that we are usually producing in these roles. And so that is a great example where you have technology and what I have challenged the team even last week. I want to see it real time, and we have all of that. We just have to switch the filters and do, so we, from a technical side, you're just wanting to offload some of that work, that kind of gets you mired down. And it's probably work that gets pushed off to the last minute too.
Yeah. Well, and I would say keep asking the question,
Yeah.
right? Because we're always asking like, okay, how can we make it easier, faster,
Yeah.
cheaper, better?
Mm-hmm.
We do quarterly quick reviews with our team. We don't wait to the end of the year. And we teach organizations how to do this, sort of create 90-day goals. But one of the questions we always have for our team is like, hey, how can you make this faster?
Mm-hmm.
This score, what one thing you could do to make it faster? The problem people say, well, you just can't. Well, as soon as I say that,
Yeah.
right, my brain doesn't work on it. Well, what if you could? What's a possible? And you just force your brain to work on these things. But I think like inserting the right question a lot of times is really helpful. We're always asking how to make it cheaper,
Mm-hmm.
better, faster, easier.
Mm-hmm. Yeah. So if we think about the future, you said we had 3 parts,
Yep.
past, present, future. But if we think about the future and where healthcare is right now, the biggest challenge
Yeah.
is workforce. Top to
Yeah.
bottom, doesn't matter what you're trained or not trained to do. Like top or bottom, workforce
Yeah.
is going to be there. Probably second to that is potentially supply or supply cost. So what are some of the unique leadership challenges that you see for healthcare organizations compared to other industries? Is there anything else besides those 2 things?
No, I think those 2 things, gigantic and huge. And I would just tell people like, it's always coming up with a better question.
Mm-hmm.
Right? Say, well, why can't we find nurses? Why can't we find this? Why is it this? And literally just going like, stop rehearsing the issue. Because really, when you think about it, workforce and supply costs, don't look at them as problems, look at them as symptoms. Right? If I look at them as a symptom, just a different way to look at it, right? Then what's the problem? Right? What's the problem for us? Hey, we have a shortage of blank. Well, what's the problem for us here? And don't generalize it, right? Because you ask general questions, you get general answers. A lot of times I think it's the problem, but if I ask myself, well, what if it's just a symptom? Well, if it's a symptom, then what's the real problem, right? Because these are both pains, right? But what problem is this pain revealing? Mm-hmm. And I think sometimes just getting like really clear, and then we do a thing called the 3P transformational process. Okay, where we'll take something like workforce. Okay, our problem is like we don't have enough team members, and then I want to know what are all of the obstacles, the specific obstacles, right? Because the only reason you have obstacles is because you have a goal, right? For example, Christy, as soon as I said I want to lose 20 pounds, I went through this process. I want to lose 20 pounds. 4 obstacles showed up in my life. Day before, they weren't even obstacles, right? First obstacle is I like to drink wine. Second obstacle is I want to eat ice cream. Third obstacle is I don't like to work out. Fourth obstacle is I don't want to put stuff in my fitness pal. The day before, they weren't even obstacles. But I solved those 4 obstacles and I lost like 10 of the 20 pounds. But the plan comes from the obstacle. Mm-hmm. And so it's almost like you just sit down and go, okay, workforce, what are all of our obstacles in hiring? And just tell the truth. And then you sit down and go, okay, take each obstacle or group the obstacles and go, what's one thing we can do this week? And give it a time frame. And you just start to move the ball forward, right? Because you can complain or you can create. You just can't do both at the same time. So you get to decide.
Yeah.
And a lot of times, like with these 2 things, it's like, well, we love to complain about it. And we love to come into our conferences and we just like commiserate together, right? Which does give a measure of like emotional support, but we just can't stay in that place.
No. Yeah. Yeah. And even the highest level executives can play the victim in that scenario where, my recruitment teams, I would try and help them reframe the conversation, like really understand why recruitment of that position has been hard. It will continue to be hard because there is just an insurmountable workforce shortage. So, talk about other things or methods or ways, is it tele, is it something else? Like, can we partner, but try and bring at least some creative thinking versus where are they? We have no one to fill these jobs.
Well, part of the problem is that we're asking these wrong questions. We're saying, well, why is it this way? Really, do we want to spend our mental energy going, why? That's not even going to fix it. Hey, here's why, right? Okay, is it fixed? No. Right. So I think a lot of times it's getting a better question.
Yeah. And I haven't been so good in the past couple of years, but to remind healthcare leaders that we are the very front end of how bad the workforce shortage is going to get.
100%.
If you're just going to think it sucks right now, like buckle up, because we across any industry,
Yeah.
it is going, you think your waiter is bad. You think your trash doesn't get picked up on time. Like it is not going to get better anytime soon.
Yeah, and it's not to get fatalistic, but
No.
a little bit, it's like, that's the reality, okay? And here's the deal. And we talk a lot about this with leaders. We call it the window of tolerance, right? And the window of tolerance is you being able to accept the demands of reality,
Mm-hmm.
right? But if I complain and I wish it wasn't this, and and I have all these unmet expectations, and really have this low window of tolerance,
Mm-hmm.
right? It's almost like I tell people, it's like, well, that's just a fantasy. Well, I wish they would come in on time. I'm like, you know what? On Mars, they come in on time. Everybody shows up on time. On planet Mars, there is no workforce shortage.
No.
Hey, we're on planet Earth today,
Right.
right? But it's really, that's leadership, is to accept the demands of reality and not to live in this fantasy of wishing it was something different. It's like, but not get mad at reality.
Mm-hmm.
Just go, this is the reality. What can I do? And be logical and systematic through it.
Yeah.
And that's part of just being drama-free, is just accepting the demands of reality and still being happy, even though there's a lot of pain and a lot of, whatever. This is just, it's like, I'm still happy and I'm still kind of sad. It's like this.
Right. Yeah.
Holding those two things.
Yep. And you can be those two things at the same time, even about the same issue.
Same issue. Yeah.
Yeah. So let's talk about you a little bit more. Do you have a leadership lesson that took you the longest to learn? And maybe it's even, a personal lesson. And then how did that shape how you coach and the philosophies that you guys use today?
Wow. Okay. So I think the biggest lesson that I'm still learning, is that transparency creates freedom. And the more transparent I can be, right? Because a lot of times, even as leaders, we make mistakes,
Mm-hmm.
right? We have issues. And then the problem is that we become we feel guilty and we feel ashamed of those things. And then we're grieved at them and we're sad about them. And what we've discovered is that grief and sadness and disappointment are compounding emotions,
Mm-hmm.
which means if you don't have space to process them, then they build upon themselves. And many leaders, they don't want to say hard, they don't want to have hard conversations. They don't want to maybe take some risks. They don't want to step out and do some things. And really what I found is that it was because I was carrying a big bag of disappointment and
Mm-hmm.
loss and things like, oh, we didn't hit our sales goal. Well, just rub some salt. Don't worry about it, right? Oh, we didn't get that contract. Oh, so-and-so quit, right? And I have all these tiny little losses that compounded.
Mm-hmm.
And so we actually created a tool called the Disappointment Navigator, where we just have you say the disappointment, we write the disappointment, you have the conversation about the disappointment, and then you get what you need.
Mm-hmm.
And this is what happens in healthcare, is that we overgive. It happens in nursing all the time. It happens with physicians all the time. It happens everywhere in healthcare. We overgive because we're not replenishing ourselves.
Oh, yeah.
And I think one of the biggest things as leaders, we have to get that emotional support from somewhere. And it is a reality. And so I think the biggest lesson that I've really learned is to have relationships and people where I can get that emotional support.
Mm-hmm.
In fact, we've created mastermind groups where it really is about hey, how do I grow emotionally so that I can go do these hard things?
Mm-hmm.
I think that's maybe the biggest lesson, is that, there's freedom and transparency and having relationships. And it's why we do a lot of executive coaching, because a lot of times, especially hospital CEOs and physicians, it's like, who do you talk to? Right? It's, you got to have these safe places.
Absolutely. Yeah, absolutely. And I know that part of, creating a culture of safety for a leader, means something different than what you try and create for your workforce. I know, in my career, I've been blessed to have friends that are in similar industries, right? Because sometimes part of the issue is, well, I could dump it all on, my mom or my dad, and they honestly, at the end of the day, have never understood what I did, what I do for a career. So,
yeah.
Or if you can find some trusted folks, within your network. I get a lot of value from people that I mentor. So I know I'm their mentor, and they're like, "Ooh, you're our mentor." I get a lot of value sometimes asking them. First, they're of a different generation than I am. They're a different place in their career and those types of things. But, getting to be able to punt those things in a safe place, around maybe my youngest son. I mean, he listens to me a lot, like he listens to podcasts and he asks a lot of questions about the industry.
Yeah.
But it's not like I can't go ask my 11-year-old what to do with some of these things.
Yeah, exactly.
Right.
Exactly. Well, here's a good way to maybe look at it. And I had this conversation with some leaders, is that, Chrissy, would you say it's hard to ask for help?
Yes.
Right? Okay, so we would say it's hard to ask for help. And when you ask for help, right, it's hard to ask for help. And we always think, do you feel like you're weak or do you feel like you're strong when you actually ask for help? You feel weak, but watch, if it's hard to do, then why do we think it's a weak thing to do?
Mm-hmm.
Right? It's actually like, no, because I've never been a leader that says, oh, it's super easy. No, it's super hard to ask for help, right? Super hard. And it's a hard thing to do. So why would we think it's a sign of weakness? It's actually a sign of strength.
Yeah.
Right? To actually have that, be able to be that person that says, hey, I need some help with this.
Yeah.
And then, because too many leaders, they just try to do it alone. You don't succeed alone. It takes a team.
Absolutely. Yeah. It definitely takes a team. And any of the hospitals I've worked in, and then the broader like health system, it's like your own community. And definitely like the hospitals, that they're probably the number one employer in town, but the people within that building, it ends up being just like this little framework of community and a neighborhood. And, and it is a very, very powerful thing. It equally has its challenges as we've talked about.
Yeah.
As we wrap up, do you have like one last piece of advice, for healthcare executives looking to transform their culture? What would that be?
Yeah, I think find a pack to run with, right? The speed of the pack I run with determines my speed. And, change is a team sport. Transformation is a team sport. So even find groups outside of like your system, especially if you're trying to transform, that you can have these conversations with, because sometimes like you cannot have it with the team you're leading. No. Right. So find this group, find this pack that you can run with, and run with them. And have people because especially as leaders, like the thing that we need the most but get the least of is constructive feedback on our own behavior. Right. And so like really like having people speak into those blind spots. Yeah. And because your team's not going to do it. They're not going to do it. So you have to have other relationships that can do that for you. Yeah. And I know that there's some really strong national professional networks, ACHE, or for recruiters, it's called AAPPR. And the networking and the opportunity to learn from others is there. And it can be hard even to take that step to reach out to people and, be vulnerable about, I don't know this, or I need help with this. And it's a sign of strength, not weakness. Exactly. Yeah. Just reframing what's happened, because we don't all know everything and we don't have all the answers. So yeah, it's true. This has been fun. Thank you. Yeah, no, I appreciate it. Thank you very much. And on behalf of PracticeLink, I want to thank you for appearing on Workforce Wisdom today. For our listeners, you can follow along the show and subscribe. You can find more information about Leadership Development Group in the PracticeLink Resource Center at practicelink.com. As always, feel free to reach out with any thoughts or insights, questions you might have today by emailing plmedia@practicelink.com. My name is Christy Bray. Thank you again for listening.